Well, the number of active cases of coronavirus down dramatically here in Indiana from about 1 in 58 Hoosiers with an active case last month to 1 in 166 Hoosiers earlier this month. That's one of the key takeaways from the latest randomized testing statewide. Wish TV's Dan Klein spoke with the lead scientist today.
Wave 2 tested people.
The much anticipated release Wednesday afternoon of round 2 of coronavirus testing, something that's not been done anywhere else.
This is evidence that the virus has slowed its spread within our state.
Lead scientist Near Menachemi revealing testing earlier this month found 0.6% of Hoosiers had active cases of coronavirus, and another 1.5% had antibodies, meaning they'd already had COVID-19 even if they didn't know it. It's a flip-flop from testing in May, which showed 1.7% had active cases and 1.1% had antibodies, for a total of 2.8% of Hoosiers affected.
It was nice to see evidence of the slowdown of the virus in Wave 2 compared to Wave 1.
But those numbers also presenting a challenge. Using Wave 1 testing, one would expect at least 2.8% of Hoosiers with antibodies by now. Yet the study found just 1.5%.
It's not just numbers, it's the why you didn't participate that's more important.
About 1,000 more randomized Hoosiers participated in Wave 1 compared to Wave 2. And if those who didn't participate did so because they already knew they had the virus, that could provide an important clue, especially with testing now available statewide to anyone who wants to get a test, unlike in weeks past.
In many ways, this is something that is probably good. It means people are getting access to testing elsewhere.
And while a deep dive into those numbers and that hypothesis is already underway, for now it's just a guess. Menachemi says the most important takeaway is the trend. More people with antibodies and fewer people with active cases.
Everything we reported is scientifically sound given what we know.
And a warning.
We should be reminded by the experiences of other states that the virus can still be transmitted if we're not careful.
That was our Dan Klein reporting. Now, the study reached out to 10,000 Hoosiers. The response rate this time around was 14% compared to 24% in round 1. Wave 3 of testing is set for the fall. State health officials, meanwhile, reporting 24 new Hoosier COVID-19 deaths today. That brings the statewide death toll to 2,289. Another 264 people have tested positive. The total number of confirmed cases here in Indiana now stands at more than 41,000.